all had a great start to 2021, as 2020, the year of the pandemic, has finally come to an end. However, the Chinese virus is not done with wreaking havoc on the world's population, at least in Western nations with their aging populations that for the likes of Italy stand at an average age of 45 against developing nations such as Pakistan with an average age of just 22 years, which at least goes some way to explain why the Covid crisis is just not as bad as it is in the West. Though India with an average age of 26 seems to be suffering that bit more than Pakistan. So is that anomaly could be down to a weaker strain of the virus, less testing, so most patients with COVID are unrecorded, much as was the case in the West during March and April's first wave of the Chinese virus. On the 4th of January 2020 at 8 p.m, Boris Johnson announced a full UK lockdown that looked set to run to at least mid-February, and in my opinion could continue into at least mid-March.
You should not be meeting friends. If your friends ask you to meet, you should say no. You should not be meeting family members who do not live in your home. You should not be going shopping except for essentials like food and medicine. And you should do this as little as you can. And use food delivery services where you can. If you don't follow the rules, the police will have the powers to enforce them, including through fines and dispersing gatherings. To ensure compliance with the government's instruction to stay at home, we will immediately close all shops selling non-essential goods, including clothing and electronic stores, and other premises, including libraries, playgrounds and outdoor gyms and places of worship. We'll stop all gatherings of more than 2 people in public, excluding people you live with, and will stop all social events, including weddings, baptisms, and other ceremonies, but excluding funerals. Parks will remain open for exercise, but gatherings will be dispersed. No Prime Minister wants to enact measures like this. I know the damage that this disruption is doing and will do to people's lives, to their businesses, and to their jobs. And that's why we've produced a huge and unprecedented programme of support both for workers and for business. And I can assure you that we will keep these restrictions under constant review. We will look again in 3 weeks and relax them if the evidence shows we are able to. But at present, there are just no easy options. The way ahead is hard, and it is still true that many lives will, sadly, be lost. And yet it is also true that there is a clear way through. Day by day, we are strengthening our amazing NHS with 7,500 former clinicians now coming back to the service. With the time you buy by simply staying at home, we are increasing our stocks of equipment. We are accelerating our search for treatments. We're pioneering work on a vaccine. And we are buying millions of testing kits that will enable us to turn the tide on this invisible killer. I want to thank everyone who is working flat out to beat the virus. Everyone from the supermarket staff to the transport workers to the carers to the nurses and doctors on the front line. But in this fight, we can be in no doubt that each and every one of us is directly enlisted. Each and every one of us is now obliged to join together to halt the spread of this disease, to protect our NHS, and to save many, many thousands of lives. And I know that as they have in the past, so many times, the people of this country will rise to that challenge, and we will come through it stronger than ever. We will beat the coronavirus, and we will beat it together. And therefore, I urge you, at this moment of national emergency, to stay at home, protect our NHS, and save lives. Thank you.
Also announced was an ambitious plan to vaccinate 15 million people i.e. all those in the 4 highest risk groups and key workers by the middle of February. Unfortunately, to date, the government has barely managed to vaccinate 2 million people, so I don't see how 15 million target is going to be achieved by mid-Feb. In fact, even half the target, i.e. 7.5 million, will be tough to achieve, which means to expect the vaccination mission to be accomplished by perhaps mid-March, by which time the number of daily deaths should have sharply fallen from the current 1200 plus per day to perhaps less than 50 per day, given that most of those likely to die from the virus will have been vaccinated by then and gained some level of immunity. In the meantime, the UK is fast galloping into the COVID storm, with COVID hospital beds now exceeding 30,000 against 25,000 at the height of the first wave peak, and the continuing news of about 50,000 COVID cases per day, which means many more patients will need hospitalization over the coming weeks. So things are definitely going to get a lot worse in the UK before they get any better, and thus the next 3 to 4 weeks is definitely not a time to be falling ill with anything, as one's chance of receiving effective treatment in UK NHS hospitals will be near zero, especially if one's skin tone is brown, given the institutionally racist nature of the NHS that has been borne out in the deaths disparity both for BAME, NHS workers and patients. Meanwhile, ONS data confirms the magnitude of the pandemic's impact, as the number of excess deaths for 2020 is at the greatest level since World War II. So imagine if the government had more closely followed the advice of the mad scientists such as Valence and the Cambridge so-called professor who had fully embraced herd immunity. UK death spikes would likely now be 2 to 3 times higher. And what about Britain's 5th largest city, Sheffield? Where do we stand in this final pandemic wave catastrophe at the start of 2021? Firstly, let's get off to some good news. Vaccinations. Sheffield appears to be well ahead of most major cities, as the over 70s have already been given their first jabs, while cities such as London, Birmingham and Manchester are still focused on vaccinating the over 80s. So Sheffield looks set for an early recovery from the pandemic due to Sheffielders' more intelligent response to some of the crazy scenes we've seen coming out of the likes of London. Hence their worst catastrophic start to 2021. The cases per 100,000 stand at just 291 for Sheffield, which is half England's current rate of 592 per 100,000 and well below some of the areas in London that are over 1,000 cases per 100,000. With the numbers starting to fall in Sheffield, which suggests we're starting to pass the worst of the final wave of this Chinese virus. So Sheffield is doing a lot better than the rest of England, where things are still worsening in terms of deaths. Again, Sheffield is doing a lot better than the rest of England, with deaths keeping to below the first wave's peak, whilst the rest of the UK sees new highs. So they're not over the worst of the deaths yet. So fingers crossed, Sheffield looks likely to experience about half the pandemic's final wave pain than the rest of England, while schools look likely to remain closed to more students who are left at home to log into lessons online. Though schools are reporting far more students have been attending than should be, i.e. dubious key workers. Though the snow and teachers getting COVID has resulted in closure of many schools in Sheffield this week, which is good because it will further suppress the virus, and the snow is keeping many more people indoors at home. So we have something good for our budgies to sing into in the new year. Sheffield is well ahead of the rest of England in terms of beating this Chinese coronavirus COVID-19. Hopefully COVID-21 won't make an appearance.